Well, we've come to the end of our third annual conference. I want to thank the people in our foundation who are involved in this work, including the guy that just walked off the stage with the beard. That's Howell Wexler. He runs our Alliance for a Healthier Generation. Jenny Ehrlich, the head of our Health Matters Conference, who works on this all year long with her team. Thank you, Jenny, and thanks to all the team. A lot of you in this audience have been part of this effort since its inception. We started it when we realized that children were part of larger communities and that we couldn't ignore the health of adults and the messages they send and the environments that they create for our children. We started it because if the baby boomer generation consumes healthcare dollars just at the same rate of their parents, we're going to make it almost impossible for our children and our grandchildren to maintain social mobility, rising incomes, and live the American dream. We started it because we're sending the wrong signals. You heard what Montel Williams said about the looming shortage of doctors and nurses. There are a lot of those. Every year in America, I'll just give you one example, there's a demand for 120,000 people with degrees in computer science. Last year, we produced 40,000 graduates with degrees in computer science. Good argument in the short run for immigration reform, stronger argument in the long run for changing our priorities. The Cleveland Clinic and the community college in Cleveland, the Cuyahoga County Community College, are the only people I know, there may be more in America, but I know they publish every year about 5 of their degrees in healthcare, starting with nursing, and say, if you get a degree in this from us, we will guarantee that you will get a job, and here are the starting salaries. So they basically are trying to take the healthcare shortage Montel talked about and turn it into an economic strategy for Cleveland. We need to do that all over America. We are trying to do something with this conference and with the comprehensive effort in the 4 areas we're working and supporting other people in other places, like the remarkable efforts Saddleback Church is making, to actually change the way we live. It's hard to do. It's hard to change a culture. But it's amazing how when something gets in the atmosphere, things start to change. You may have heard that earlier today I said there's now a new study out that all the major food manufacturers are producing slightly smaller or different packages so that the aggregate calories going to people who think they're eating exactly what they did last year are about 80 calories a day less than they used to be. And over a year, that adds up. A lot of things are changing, but we have to find ways to take what is known through a delivery system to actually change people's lives. And that's why I'm delighted that you're here. I want to also thank our sponsors again and thank the PGA for asking me to try to help with what we used to call the Bob Hope Tournament. I thank Humana for sponsoring it and for committing, along with Tenet Healthcare and our big sponsors, to begin this tournament focused on the health of Americans. I want to thank all of those who have talked not only about chronic diseases, but about the problem of prescription drug abuse in America, which still kills more young people every year than cocaine and heroin abuse combined. And I thought about it today because the person that got me involved in this, my friend Vin Gupta, who wanted to be here today, because his son died of a prescription drug problem, and he was not addicted. He drank a bunch of beers, and his girlfriend said, wouldn't you like one of these? It'll give you a buzz. If you take that after dark, it kills the part of your brain that tells you to keep breathing when you go to sleep. And an enormous number of people have died in this country in the last 5 years who weren't even addicted to prescription drug pills just because they took it in combination with alcohol and they didn't know that simple biological fact. Then he went home to India to bury his 95-year-old father, who worked until the month before he died as his village's doctor. His son made an enormous amount of money. His father, about 2 years ago, gave away all of his possessions except 4 slacks, 4 shirts, and the requisite pairs of shoes and underclothes, saying that once he got over 90, he didn't need anything anymore, and his whole life was keeping his people healthy. I say that to remind us all that sometimes with all this modern technology and all these modern breakthroughs, what we really need to do is to recover our ancient values of community and a sense of intergenerational responsibility, which govern the lives of most of our parents and grandparents and great-grandparents, whether they lived in the United States or somewhere else. We can't get so carried away with all of our gadgetry and the fact that an 8-year-old can get on the internet and find out in 30 seconds what I had to go to university to learn, to forget that you still, in a very fundamental way, are what you believe in. Your life is still defined by how you see your obligations, your responsibilities, and whether your happiness is rooted in the well-being of others as well as yourself. There is an enormous amount of data that only proves what we all know, that we basically are all in this fight for the future together, that we are more interdependent than ever before, that every new scientific breakthrough and every new technological breakthrough only makes us that much more interdependent. And therefore, those of us who've had fortunate lives should assume greater responsibility to see that everybody can be part of what should be the most interesting, prosperous, peaceful time in human history, but could be calamitous if we ignore our responsibilities to ourselves, to our community, and to the planet we all share. So I think this is a huge deal. I think it's a great thing that we've turned around so much of what's happening in our schools. I think it's great that there's so many people involved in First Lady Michelle Obama's Let's Move initiative. I think it's amazing that all these food manufacturers have decided not to quit making money, but to make money in a different way. All those soft drink companies that helped us cut the calories going to schools by 90%, I told them all, I don't want any of you to lose money. Let's figure out how to make money a different way. If we all do this together, there's got to be a way, since people like to drink things and they get dehydrated, we can do this. There's a lot to be hopeful about here. But don't kid yourself. The reason that we're still having this conference and the reason people show up is that there are also a lot of remaining challenges. And I kept thinking when Rick Warren talks about what he's done with Saddleback, that's basically how a lot of big companies that sell low-cost consumer products in great volume have decided to do. They use big data. In his case, his big data is he got a church with 25,000 people every Sunday, right? They use big data, and then they figure out how to use the data where people live so they can make personal contact. That's what President Obama's campaign became famous for last time. They had all this data they could analyze, and they'd say, okay, go to this street, ignore these 10 houses, knock on these 4 doors. Still had to be somebody that knocked on the door. Otherwise, it'd just been a bunch of information. And that's why sometimes I get frustrated when I go places and give talks and repeat information, and I know darn well that some people in the audience already know what I'm about to say, and others will be glad to know it and will absorb it, but if there's no system to do anything with it, I wonder. Sometimes things just happen in the atmosphere and people change their behavior, but we're here because we think we have the discipline and the ability to translate what we know and what we feel into positive changes in other people's lives. And I thank you for that, more than I can say. I thank all of our participants. And I'm looking forward to next year, but more, I'm looking forward to what all of our people do between now and next year. I think it's astonishing that 90% of the commitments made last year have been kept or are going to be kept. They're being kept as we speak. We just need more commitments and more keepers. Thank you very much. God bless you.